Okay, so let's finish up with the lower limb, and we're going to look at the femur, the patella, the tibia, fibula, and the bones of the foot. So let's first off take a look at the femur. The femur is the largest, heaviest bone in the human body, and it can support an enormous amount of force. It can handle like 10 times your body weight. So a femur can handle about, for me, over a ton. Now, there is likelihood that something else on me would break before the femur would, but the femur is a very powerful bone. It's the sort of caveman bone that you used to see in the caveman movies where they're clubbing people over the head and things like that. So let's take a look at the specific markings associated with this bone. And you can see, rotate it here, what? It's got a structure here which is the head. And that is covered with cartilage, and it articulates with the acetabulum of the coxal bone. Now, we also have a neck, and there is a little area here we would say that's the surgical neck. Is if you were to do a cut, you would do it right through this area if you were replacing the hip or something like that. And there's a video on the course website that shows cuts and other items that you may or may not be interested in. Now, other structures. We have a lesser trochanter and a greater trochanter associated with this. And these trochanters, again, a T word, anything sticking out as a muscle attachment. So these are very large bony attachments. They are what the gluteus muscles attach to. So we have the gluteus maximus that attaches to the greater trochanter up here on top. We have the gluteus minimus that attaches to the lesser trochanter, and we have the gluteus medius, which actually attaches in this line located here. Now, other structures, we don't need to worry about the gluteal tuberosity. I want you mostly to be able to identify this bone. You should also be able to identify the medial condyle, and the medial condyle is going to be on the same side that the head is, and the lateral condyle is going to be on the opposite side. And we have this intercondylar fossa, and this is where the cruciate ligaments are located. Now, it doesn't really show it here, but there is a patellar surface that the patella, which is a sesamoid bone, slides in. Now, let's take, that's really all we need to know about the femur. So let's go to the next bone, and we're going to look at two, actually. The lower limbs, as you remember, we have one large bone in the upper part of the limb. We have two bones in the lower. And we have the tibia, and just an overview here. Now, this is the bone, actually, that supports most of your body weight. Really, we'll say all of your body weight. The fibula doesn't really do any support structures. It is an accessory structure, and it makes up part of the ankle. So the tibia, structures that I would want you to be able to identify on the tibia are, we have, again, this, you can call it the condyle, lateral, medial, articular surfaces. And the way you can tell lateral and medial on this is that the malleolus, which is this structure here, is on the medial side. That's the medial malleolus. fibula actually makes up the lateral malleolus. And these two things together make the inner and outer part of your ankle. We also have, located here, the tibial tuberosity. Now, when we start looking at muscles, we'll talk about raised surfaces tend to be surfaces that are muscular attachments. Also mention that muscles have to cross a joint. So in this case, the muscles cross from the upper thigh and they cross the knee joint and they attach here. So the rectus femoris, the vastus lateralis, the vastus medialis all attach in this area to allow us to kick. And honestly, let's back up here a little bit. But again, there's not a huge number of structures that I expect you to know. So, let's go back and we want to take a look at the patella. Now, the patella, it's a sesame seed-shaped bone. That's why we call it sesamoid. And it slides on that patellar groove that's on the femur. Now, the reason we have this is a couple of reasons. The patella protects materials inside that joint. So those cruciate ligaments are protected. And it slides as we move our leg or move the joint. So it's got cartilage here. And those muscles of the thigh, they come in, they cross over that. They attach to it, but they cross over that and attach down to that tibial tuberosity. And that little bit of kind of pushing out that it does gives us a little more leverage. It allows us to kick a little harder, to move a little faster. I would say largely it has a protective feature. And let's take a look here. There's really not much that I could ask of you in looking at that other than what is this bone, which is the patella. So that one's easy. Now, we looked at the tibia, we looked at the femur. Let's take a look at the fibula. And again, there's not a lot that I would ask about the fibula. It makes up the outer bone of the lower leg, and there's dense regular connective tissue located in between it and the tibia, which allows a twisting action that can occur. And the biggest thing that this does is it makes the inner part of your ankle. And you'll notice that this is a fairly thin bone. This can be broken relatively easily. I am going to post a link to a video on the course website that shows a distofibular fracture and what can happen, because the ankle really locks the foot in place. Now let's go back here. Let's go back, and now we look at the feet. Now, when we look, the first thing we're going to notice, we have bones that are called tarsals rather than carpals. And we have two particular tarsals that are really important to us. The rest you don't need to know. And if it helps you remember, T for tarsal, T for toe, so And carpals, everybody pretty much knows the carpal tunnel. But the two specifically that I want you to know are this one here. That's the calcaneus. And it is the heel. Additionally, there is a tendon, the Achilles tendon, which attaches to the calcaneus here and attaches to the gastrocnemius and soleus muscles, which allow us to stand on our tiptoes. Now, you may not think that's important, but it really is a means of allowing us to kick off and move, and it absorbs a good deal of shock. So the specific ones, again, you don't need to know the lateral cuneiform and the intermediate cuneiform. What you need to know is just the calcaneus and the talus. And again, the talus bears most of the body weight. Just like we have carpal or metacarpals, we have metatarsals. These make up a big portion of the arch of the foot. You don't need to know anything else about them, but we've got 5 of them. And then, just like the fingers, which have phalanges, we also have phalanges of the toe. That's very similar. We have 3 phalanges on 4 toes. The big toe, just like the thumb, has 2. So we have the proximal phalange or proximal phalanx, the middle phalanx, the distal phalanx. Again, no other bony markings that you should be able to identify as a result of those. So, with all of that, I think that concludes the bones of the appendicular skeleton. I have a separate video on joints, and I have, I'm going to put some materials on actual structure of a long bone. So, hopefully that covers everything. Thank you. Okay, I actually found the video that I was going to show you, so I'm just going to include it in here. Just give me a second to load this up.
Totalmente desafortunada, aquí la vamos a ver. Él solo se provoca la lesión porque se le queda prensada el pie derecho, se le queda prensado en el césped, se atora Andrés, se atora Jesse, y es una lesión realmente espeluznante, una acción que desafortunadamente lo va a mantener fuera de circulación pues por lo menos unos 5 meses a este muchacho.
En el tobillo, empezando el partido, esto fue clave, el cuerpo médico de Cruz Azul.
That was the ankle break I was telling you about. That was a distofibular fracture. It can result from a twisting action or a severe bending action. And in his case, as a result of that, it twisted completely out of the socket. Now, they did reset that on the field, and the reason that they did that was he had the blood supply to the foot cut off while it was in that twisted position. So if they had not moved it back into the appropriate position, he might have lost his foot. As it was, and this is the amazing thing to me, he went back and played professional soccer the next year. I would not have been able to do that. I think every time I was going for the ball after that, I would just go, "Ben, yours," you know. So I just thought that was kind of a good example of what even a small structure like the fibula, a really thin bone, can do, what can result if there's some damage to it.